Something that I want us to think about is, do we talk to kids in a way that they actually know what we're talking about? So it's actually quite common for adults to make assumptions that the child that they're speaking with actually understands what they are saying. But the reality is that many times children don't. They don't have the life experience, they don't have the details of the context that the adult is holding. And so there's a lot of data points that sometimes children don't have, but we as adults think that they have. And what ends up happening is that they're not actually understanding what we're saying. And what I want to talk about are the implications for this potentially for the child. And I'm going to give an example of going to the dentist. So let's imagine that a young child has never been to the dentist before, right? It's their like first teeth cleaning. And let's imagine that an adult says to this child, okay, so we made you a dentist appointment. So, first thing, are we making an assumption that the child even knows what a dentist is in that sentence? But let's say that they know what a dentist is. Maybe the second part of that sentence sounded like this: you're going to be getting your teeth cleaned. Okay, so up until that point, the child likely has had some experience with having their teeth cleaned. And it likely looked like holding this thing with some bristles on it, and you squeeze this stuff out of a tube and you put it on there and then you put it in your mouth and you like move it around and you spit it out, and that's what teeth cleaning means in the context of the life experience for the child. But what happens then is the child actually shows up at the dentist's office and they walk into the room and they see this weird looking chair. And they see these different sort of devices around the chair. And maybe the child is asked to sit in the chair and put on these sort of goggle looking things. And next thing you know, there's a right, and they're like now in the incline, like moving back, and now there's a bright light in their face, and now there's someone standing over them with these tools, and the tools are about to go inside the child's mouth. And then we wonder why the child is so unbelievably anxious and scared and doesn't know how to navigate the situation. Because the child did not have a context for what was about to happen to them, and the adult made an assumption that the child understood what it meant to go to the dentist and have your teeth cleaned. So that is an example that I want us to really think about as adults, whether we are a parent, whether we're a teacher, whether we're a therapist. How often do we talk to kids in a way where we expect them to know what we are talking about? And then because they don't, how do we inadvertently actually create some anxiety in their system? Or what the child's brain likely is going to do is fill in the gaps and create a fantasy or a story about what is about to happen or what they're about to experience, which sets them up potentially, if reality doesn't match that or was a little bit different than the way they thought it was going to go, for them to have a dysregulated response, which makes complete sense that that would be the outcome in those moments. So that's something that I want us to think about as adults. When we're talking to kids, how do we speak to them in a way where they actually understand what we are talking about? And how do we verify that they actually do understand? It's actually one of the most helpful things we can do for a child's brain. We call it making the unknown known, and it does wonders towards helping children navigate that experience and reducing some of the anxiety that they might be holding inside because they're just trying to put together the pieces based on whatever it is that we have just said. So, talk to kids in a way where we have a high probability that they understand what it is that we are trying to explain to them, and let's make sure that they do have a more concrete picture of what whatever it is that we are trying to communicate.